sarcasm, please follow me and leave a comment too. Today I have with me Kylie. She is an oncology nurse. How's it going?
Good.
Good. So we're not going to talk about where you work, and we're also not going to talk about any stories that you might find juicy, but might violate the HIPAA code. So we won't do that. I won't. And I also will try not to ask any questions that might get you fired wherever you work.
Okay.
So I took my foster kid to the doctor. She stuck a pen in her ear.
Oh no.
And so anyways, we we were having a bunch of issues with her ears and, earwax and all that stuff. Anyways, so they were talking about Q-tips and how you should or should not use Q-tips and blah blah blah. So when I was talking to the nurse, I asked the nurse, "Hey, do you use Q-tips?" And she told me what she does with Q-tips. And then as we were walking out, I was talking to the doctor and I said, "Hey doc, do you use Q-tips?" And she got all offended. She was like, "I'm not going to answer that. That is a personal question." I
What?
was like, "Oh, okay. Get your panties all in a bunch." So, hey, Kylie, if I ask you any questions that you don't want to answer, just say, "That's personal,"
Okay.
and we'll move on. All right. So, one burning question I have you ever seen that? Have you ever seen the mini series called Painkillers with Matthew Broderick?
No.
Oh, okay. It's about Oxy. And anyways, it talks about all the hot girls that they send in, how Oxy, the big pharma, sends in these hot girls to doctors, and they ended up doing nasty things with them, and then they have all these big parties, and they give away all these stuffed animals and everything, all to make the doctors sell the Oxy and sell more and more Oxy. Then the doctors get all these incentives, and including girls and whatever. So, so one question I have for you as a nurse, just in general, do you guys get that? Do you guys get to go to these fancy parties and get to go get wined and dined and all that stuff so you can promote their medicine?
Not necessarily. We'll have like drug reps come in and bring us like a lunch to talk to us about like new medications or like side effects of a medication or do like a lunch and learn.
Okay.
So more like a learning environment of a medication. So say like we're going to get a new chemotherapy medication or a new oral drug, then a lot of times they'll come in so that we can do like an education series.
Okay. So not like, "Hey, subscribe my drug and you're going to get this," or
Exactly. Yeah. So it's more like education program that we'll do. And then they'll usually, sometimes we'll get like dinner with it. I don't ever go to dinners just because if I'm off the clock, it's my family time. But like if they do like an education where they come in and they'll bring us like lunch at the clinic, I'll try to like swing by just for like more of an education purpose.
okay. Well, that's boring. Darn
It
it.
is. It's not
Uh,
exciting.
yeah, I was hoping for some, glamorous stories and hearing about all the stuffed animals and everything else that you get, but oh well. Okay. So, let's just talk real quick. How long have you been in the nursing field?
So I started out as the CNA at 16, and then I moved at a nursing home, and then I moved into a CNA, my current job as in oncology at 19. And then when I graduated from nursing school 7 years ago, I stayed where I'm still at as a nurse. So I've been there a
Wow.
total of 11 years at my current job, 11 and a half years.
Wow. Age 16. Holy cow.
Yes.
Good for you. You were raised with good work ethics. Good for your parents. How about that?
Yes, they definitely instilled that in me.
Nice. Very cool. And so, have you always worked with the same doctors since you've been in oncology, or have you worked with multiple different doctors?
So when I started out as a CNA, I was in infusion. And so I worked with everybody that was receiving their treatment. And so that really allowed me to get to know all the different types of treatments, which is really cool. And then I worked with another provider. And then when I finished school, I stayed with that provider. And then when she left the clinic to go to another facility, I ended up with the current provider I am with. And I've been with her for 4.5 years, almost 5 years. And I adore her. She's just an incredible provider.
Awesome. Are you a CNA or what is your actual title?
So I finished nursing school I finished nursing school 7 years ago, and I'm actually an LPN, so I'm a licensed practical nurse.
Oh, okay. Sorry about that. Okay. So now back to my question. Do you get to pick nurses or pick the providers that you work with, or if something opens up, do you get notified or how does that work?
Kind of. So you can kind of pick who you work for. I was kind of placed with the current provider I'm with because her nurse that she was with went out for a knee replacement, and they asked if I would cover, and I did, and then I never left because I
Nice.
loved her so much.
Okay. All right, cool. That kind of leads me to my next question. So, first of all, what is your role as an LPN when you're in the room with the patients? What are you doing?
So I scribe for the doctor I work with. So I do her notes. So I scribe her notes as well as I help make sure that all the orders are being placed for patients. So their lab works, their imaging, any biopsies that need to be done, referrals that need to be placed. And then I also do like a summary of the patient's visit for them in layman's terms so that when the patient leaves, they kind of have an understanding of what is coming up next for them and what their schedule is going to be looking like. And then that also helps our scheduler. Our scheduler knows how to schedule them. And then it really also, I kind of bridge like a little bit of a gap. So like if patients have any questions, I can kind of help fill in anything and they can always have a face to a name. So when they're calling, they always know that there's a face to the person behind the phone.
Okay. That was one of my questions. First of all, my oncologist is usually very timely, but is there a reason why doctors are always late?
So sometimes, like for example, on Monday, the provider I work for, we were running about 20 minutes behind, which is very abnormal for us because we are normally very on time. And she was also on call, meaning that anything that was coming through the clinic for any of the doctors that were not there for their patients was coming to her. So she was having to answer any of those questions for those nurses that had any questions, the triage nurse. We had patients that unexpectedly ended up in the hospital that we were needing to go visit while their family members were there. So then we were trying to work around that schedule. And then emergent situations come up with patients that providers call from sometimes university hospitals, emergency rooms, and we've got to get the provider on the phone with them to deal with that situation right then and there versus the end of the day.
Okay. All right. So it's not just because they want to be late and they want to make you sit there and anticipate being, what's going to happen? What's going to happen?
Right.
But do the nurses then do they have a little bit of extra time so that they can stop and answer questions for the patients after the doctor leaves, or are you guys kind of on the same clock?
I always try to be available to answer questions for the patients when the provider leaves because I think it's important that the patient when they leave that room they feel very confident in one their doctor and their visit and everything that happened during that visit. And so that then when they leave they can leave their cancer world behind in our clinic and as they step out of our doors, it is just a shadow that is not always lingering over above them and not controlling their lives.
Awesome. So I have several, I feel like, saved by the day nurses stories when I feel like the oncologist didn't have the answer, didn't didn't have the time to answer the question. I'm not sure, but anyways, then I would go to the nurse, or the nurse would follow up with me and say, "Hey, I have this suggestion or that suggestion," and give me the answer that I was looking for. And so, how comfortable are you on a day-to-day basis, or is it expected maybe that sometimes you have those answers that the oncologist doesn't have? Because I know, like, as a paralegal, as a lawyer, I would have paralegals, and they would often have some answers that I didn't have because, they're doing the day-to-day stuff. So you're the same way. But do doctors get offended by that? What does that look like? 'Cause I just wonder, sometimes you don't want to ask the nurse, sometimes not in front of the doctor, or does the nurse want to say something after the doctor leaves? Does the doctor get offended if you know the answer, but they don't? It's a loaded question. Here you go.
Right, and I think sometimes I think that's the great I think it's when having a really good partnership with your provider and nurse is really important, and being able to know that, "Hey, maybe I can explain it in a different way to where the patient might be able to understand the answer to their question a little bit better." Or, "Hey, we had a patient who I helped through a similar situation and it worked really well. Their family member or another nurse that helped them suggested this to help them through this scenario." And so then we have that experience from a nursing perspective to be able to walk the patient through. And I think that's where we as a team each fit into the puzzle to create the picture for the patient. And that's where having a really strong team comes in handy. Like on my team, I go into the room, I scribe with the doctor, I put in the orders, and I can kind of be there to really get to know that patient. How does the patient best understand what's being talked to them about? Do I need to maybe explain it in a little bit different way, or talk to the doctor about maybe trying to explain it to them in a little bit of a different way? And then we've got our case manager nurse who is there to really answer their questions about their work and their FMLA paperwork, and to have the time to really spend on them with the phone about side effect management. And then we've got our EMT who's the first face they see, and she also has ER experience. And so I think that as a whole, being able to know that we each have our own strengths and we get to bring that to our patients and we respect that in each other really helps us completely take care of the entire patient. Long answer short, the provider I work for does not get offended at all when I stand with a patient to explain something, or when I kind of step in to redirect a question or an answer for the patient so that they better understand it.
And is that kind of your expected role, or not really?
Yes, it has kind of become my expected role just in the time I spent with the provider I work for.
And have you ever, with other doctors, have you ever been in a situation where they've said you've overstepped, or you felt like you've overstepped, or just offended the doctor?
No, not in my clinic, and I think that comes because we have doctors that really respect their nurses and the nursing staff as a whole.
And have you heard from your friends that that's how it sometimes pans out?
It can, I think, in certain scenarios, but overall, I think, especially in today's day and age, I think that doctors have more respect for nurses
Well, that's good.
overall, which I think is really important.
Yeah. So hypothetical then, if I'm sitting there with the doctor and I'm just not getting the answers that I want, would you suggest then that I just wait till the doctor leaves and then follow up with the nurse and say, "Hey, do you have any insight into that? Do you have any, anything you wanted to add to that?" Or would you suggest that maybe the patient does it while the doctor's there? What do you think?
I think it depends on the patient's comfort level with their provider
Okay.
and their nursing staff. Because for some patients, they want, like, I want my scan results and I want the medical plan from my doctor, and then I want the fluff from my nurses.
Oh,
And then for other patients, they want everything just from the or for patients, they just want everything from the medical provider. So they will be like, "Hey, wait a minute, I'm not understanding that. I need you to rephrase that." Or they'll say, "Hey, actually, that's not making sense to me. I need you to rephrase that in a way that makes sense to me."
and how long do you actually have? So I'm going in for a review, just to go over my records. How long are they actually planning? Because sometimes I feel you don't want to feel rushed, but sometimes I do feel rushed, and it's like, do you have enough time to answer all these questions? I mean, for people that do feel rushed, how often or how long are you actually planning to be with that patient for those reviews usually?
Usually the provider plans about 20 to 30 minutes depending on patient arrival time. And I know in our clinic, we really encourage patients to arrive 15 minutes before their appointment, just so that that gives them enough time to walk down to our what area and check in and get their weight and their vitals and go through their questions. And then to then take the report to the provider and then to for the provider to come in. And then if you always tell the provider, like, "Hey, these are my list of questions that I need to go through," or like, "Hey, this is moving too quickly for me. Let's take a step back." I think it can be really, frightening for patients to come in to have to take a visit with a doctor and a provider, especially when sometimes some providers move quicker than other providers just in like their speech and their mannerisms. So
Yeah.
then some patients feel rushed because of that, even though the provider may not necessarily be in a hurry. And so then just like telling the provider, "Hey, actually, I need these questions. Can we please go through these questions that I really need to be answered?" And the provider most of the time will be like, "Absolutely." So I always tell patients, you are your own best advocate. And if you don't feel like you're being heard, let's figure out how you can best be heard. Do you want me to step in during the clinic visit? Do you want to have, we've got a really incredible social worker and social work team at our clinic. Do you want to have one of them in the clinic visits to be your advocate to make sure that you're being heard during the visit? So we really have ways to make sure that patients are being heard during their visits.
I'm really bad at that, showing up 15 minutes early because I feel like I don't know why people ask me to show up 15 minutes early. It's like I get there 15 minutes early and then nobody ever really takes me back until the time. So I just think that's so I'm not late. So I just usually show up on time. But now you've just explained it to me and I'll try and do better about that.
I'm I'm, like, the worst about it. Like, I'm so bad. Like, at my kid's pediatrician office, I know our pediatrician, like, personally, and so I always tell the girls, I'm like, "Never, ever, ever tell me the appointment time," because I am so bad about being late because I will try and put as much into my day as possible, and then I'll realize, "Oh my goodness, it is, like, 5 minutes ago I should have left the house."
Well, okay. So at least I'm not the only one
No.
for sure. How educated do you or the doctor feel like people come in, especially like in the beginning, I feel like when I first came in, and I don't know if it's because I'm a lawyer or not, but people would say to me, "Well, you've probably already read about this, or you've probably already read about this, or you probably already heard about this, or something." And I was just like, "No, because I don't know. I don't, I
Right.
you go to Google and there's just so much information. It's overwhelming. So half the time, no, I don't know shit. I'm hoping that the doctor knows. So how prepared do you guys think that we are? And do some people show up more prepared than others, or what does that look like?
It kinda depends. So I really have, like, a love-hate relationship with Google because it can really take people down some really crazy pathways, um, and especially, like, with breast cancer. So there's this umbrella, you have breast cancer, and then underneath that umbrella, we have so many different types of breast cancer and stages, and hormone positive versus triple negative versus HER2 positive, HER2 negative, metastatic versus stage 0, essentially, or invasive ductal carcinoma versus, you know, so there's so many different types of breast cancer, just breast cancer. And are we going to start with surgery versus chemotherapy, then surgery? Are we going to do a lumpectomy, mastectomy? And so Google is wild. And so when patients, get their initial like diagnostic mammogram that then leads to their pathology and biopsy, and then they either get to us right away or the surgeon and then us. Sometimes I think that doctors are like, okay, they've already been on Google. They've already been, talking to, their great aunt Becky Sue, or their friends. And so we're like, oh goodness, what are we going to be walking into? So I think sometimes doctors do have like a idea that these patients are coming in with some sort of knowledge just based off of, they've been looking up their pathology. For me, I always tell patients, you don't know what you don't know. Welcome to cancer kindergarten,
Mhm.
because there is so much to know. Please always write down your questions. And one of the things I do is I tell patients to open up their phones and make a notes app, or like a note on your app on your phone under notes,
Mhm.
make just like cancer questions. And as questions come up, just start writing them down to either bring to appointments or to call our team with. Because I would rather them calling our team or talking to our providers about their questions versus having to Google things. But for myself, I expect patients to have very little knowledge about their cancer and the treatment, or a lot of knowledge coming from internet and friends.
Okay, and sometimes that's misinformation.
Correct. And so how best can we weed out the information that they have and put them on the correct path? And so sometimes I think doctors do have an idea that patients have been on the internet already and have like an idea, or they've been on online support groups, possibly reading up on things. And so like if a provider comes in with that, you can always be like, actually, I have not read anything. You are my knowledge base, and I'm come in here to hear everything that you have to say to me.
Okay. And are there patients that seem like they're more prepared, or is there anything that, I don't know, that you see that you might suggest to somebody to do or not to do before, especially when in the beginning when they're, or when there's a change in diagnosis or something, when it's just shit's really hitting the fan, it feels like.
Definitely. So when it's really hitting the fan, I think getting a binder that is like your cancer binder, and having an advocate is huge, whether that's a friend or a spouse or sibling or whoever it may be, to come with you to be a second set of ears. Because when all that information is flowing from either your first visit, or you're going over a set of scans, or you're starting a new treatment, or crap is hitting the fan and you're switching up treatments, or you're needing to take a treatment break and put a pause on things, and you need that advocate in the room with you, just really having that person there with you. But having that 3-ring binder to where you can have a place to write down your questions, keeping track of medications that you're on, because when you start treatment, I have so many people that have never taken any medications in their life except for like a Tylenol or an ibuprofen as needed. And then all of a sudden we're handing you over 4 or 5 different medications to take on a different schedule. Or like if you're on an oral medication, we're completely jacking with your meds, and you may be on it for 2 weeks on, 1 week off. And so having a calendar where you can write down and see, like, this is the day I'm starting my meds. I took it this day. I took it this day. I took it this day. And then I stopped it for this week. It's time for me to get my labs done for this time. So, like, having something physical where you can write down all of your information and track that, I think is really important. What everything from your questions to your medication tracking and symptom tracking.
especially
Because
when chemo brain kicks in.
yeah, and chemo brain is a real thing. It is 1,000% real thing.
Well, that's good to know.
um,
Sometimes you feel like you're just making it up, It's like, really, like people say that, menopause. Oh, menopause is not, that's not really a thing. People in Europe don't have these problems with menopause. They don't have hot flashes, et cetera, et cetera. It's like, huh, okay.
baloney. I put enough women on aromatase inhibitors or anti-estrogen where we're blocking their estrogen because they're on hormone positive. They have hormone positive breast cancer. Menopause is very real.
Yeah.
That's probably, like, my biggest thing is, like, having somebody there to do that, and then a way to really organize your information overflow.
Okay. That's great advice. And you talked about breast cancer, how many different kinds of breast cancer there are. Is breast cancer one of the more complicated types of cancers in that it has all different kinds?
So the doctor I work for, we mainly see, like, breast, GYN, so, like, gynecology, gynonc, female cancers. We see a little bit of lung, a little bit of GI, gastrointestinal cancers, and some blood cancers, but we see all the breast cancer in the clinic. And so breast cancer is what I'm most familiar with. So I can't speak to a lot like prostate or lung cancers or head and neck cancers, but breast cancer can be very complex because now we're even seeing women with like metastatic hormone positive cancer or like HER2 low or negative, and then it it's progressing through treatment, and then we rebiopsy it and then it's positive. It becomes ER positive or HER2 positive. And so then we're going back and we're having to change treatment. So the pathology can be very unpredictable sometimes, I would say. It's very interesting, but then at the same time, the amount of breast cancer treatments that are coming out, even in just the 11 years I've been in oncology, has been.
Wow. It's so when you're looking into getting into this field, do you do oncology education? Are you doing like ongoing education? Are you learning about the different types of cancers while you're in school, or is that more of a practical, you're learning as you go kind of thing?
So, like in nursing school, you cover about a chapter or two in oncology. It's just not something that's covered widely.
Wow.
And so, if oncology is something you really want to go into, it's kind of you learn as you go. And so, you're really learning while you're there. And then there's lots of things that you can do. The majority of our nurses at our clinic are what's called oncology certified nurses. So they have their OCN, which is incredible. It's an extra test that they have to take. And we do continuing education throughout the year and yearly because there is so many things that we have to do, like oncology, emergencies. Our patients can become neutropenic, so their white blood cells can drop. So yeah, it's definitely a learn as you go kind of field, but
Okay.
it, it's the most amazing nursing field, I think.
And what about that certification? How long does it take to get that? And what kind of things do you have to do for that?
So our girls that have it, so it's one that I cannot get as an LPN. You have to have your RN, I believe. you the girls study for it usually a minimum of like 6 to 8 months, and then they have to go and sit for the test. So kind of like sitting for our nursing boards, you sit and take the test. It's a very in-depth test over everything from different cancers to treatment to oncology emergencies.
And that ongoing education that you do, is that specific to oncology?
Yeah, so we do like hospital-wide education for just nurses in general, and then we have oncology specific education that we complete.
Are you required to take oncology specific, or is it just up to you, whatever you wanna take?
We are required to do oncology specific education at our clinic.
Is there a big Do you know, is there a need for oncology nurses in Colorado, or
Absolutely. Just because it's such a specific field. And I think mainly not just like so infusion, there's different types of oncology nurses. So there's like infusion who work out on the infusion floor giving the anti-cancer treatment drugs, so chemotherapy, immunotherapy, giving the injections, IV fluids, blood products. Then there's education nurses, so they're actually the educators for we as nurses. So they're nurse educators to educate nurses. Then there's case manager nurses, and then there's, like, clinic nurses, like I am.
okay. And I'm assuming that the education nurses have to have just a shit ton of experience.
Yes, and be up to date on everything and keep all of us up to date on everything.
Okay. In your experience, is there any cancer that has hit you as being more tragic than others, or any scenario that has hit you as being more tragic than others?
I think one of the cancers that is just heartbreaking, I mean, they're all terrible and awful. I think one of the cancers that's just really heartbreaking is, like, pancreatic, because usually it's caught later stage, unfortunately, and then, like, breast cancer currently, we're just seeing so many younger women getting breast cancer.
Yeah, that's what I heard. And I mean, do you know, have you heard about anything why that is? Is it diet? I mean, do you have any opinions? Have you learned anything? What's the scoop?
I think our diet, our environment, genetics, I think everything's just really feeding into each other and creating the perfect storm.
How
And so I
about
think
the do it yourself stuff, Ivermectin and things like that? Do you have any input on that, or big pharma? Any input on that?
yeah, so we see a lot of patients that do the ivermectin and fenbendazole route. The biggest thing with that is it can really mess up patients' liver and cause liver toxicity. And so what'll happen is they'll be doing that, and then their liver enzymes will really increase, and then we can't give them their regular treatment anymore until their liver goes back to normal.
So that could really put a
And
damper on something if you have aggressive cancer.
very much so.
And how long does it take, like when your liver is in jeopardy like that? What is the healing time for a liver? Is there any rule to that, or just patient by patient?
Um, Usually minimum of like a month or so, kind of depending on how far off the labs are. And so we just really have to watch the labs and the patient, but it can put us behind quite a bit on treatment.
How about you? How do you defrag at the end of the day? You said that you have family time, and so is this your, kind of obviously I think you're on your day off, so you're doing this on your day off, but how do you defrag? How do you deal with it all?
Well, I try to not bring a lot of it home, but my patients are a huge part of me and who I am. My mother-in-law is she passed away in 2023, in April 2023, but she is the main reason I am an oncology nurse. She had a rare blood cancer type called Castleman's disease. It kind of falls in with like similar to like a kind of like a leukemia lymphoma. And she is the she was a patient of one of the oncology providers at the clinic, and I'll never forget, she said, "I think you need to go work in oncology," and I said, "I think you're crazy, that sounds sad and depressing." And I was working at the nursing home, and she just kept encouraging me and pushing me, and our oncology clinic had just opened up where I'm at. And so I went and I started working, and I was like, okay, I love it. This is amazing. These people are incredible. And they quickly just became part of who I was. And then wild because I'm still some patients that have now seen me get married,
Wow.
um, have both my babies, graduate nursing school. So they just become part of your family. And then everything was all in God's timing because I ended up getting to be at my clinic when my mom was diagnosed with a rare form of melanoma called ocular melanoma. And she made it, I want to say, 4.5, 5 years from her initial diagnosis before she passed away in 2023 as well,
Wow.
from metastatic. So for a while, I was bringing it home with me because then I was caring for my mom full time during her illness and then while she was on hospice. But now I try to leave it behind and just play with my babies and go into full mom mode. We camp a lot and enjoy being outside, and we have animals, and so that keeps me busy and my husband.
And you've had a lot of it in your family. So are you super cautious about it? I mean, I have a friend that she's going to be in one of my podcasts here shortly too. And, she has a huge history with breast cancer, but she comes with this frame of mind like, I don't want to know about it. I just, if it happens, it happens. I'm not going to sit and worry about it, and then you have the people who, oh my gosh, my mom has the BRCA gene or I have the BRCA gene. So I'm just going to go cut my breast off and try and get at it from the beginning. So how do you deal with it? And how do you deal with it as a mom too?
Yeah, so I've already had genetic testing because of my family history, because of my grandma and my maternal aunt, and my maternal great grandma all had breast cancer.
Wow.
So I already had genetic testing. Thank goodness it was clean and clear. I've also already had a colonoscopy because I am crazy and, symptoms are weird. And so then, you hear about patients with these symptoms and you kind of sort of have a symptom. And then, so, you know,
Yeah.
so you're either, I think sometimes you're one way or the other, but you are more cautious. I definitely am very conscientious about what my family eats and how we live our lives to a certain point. It's all balance, right? But what I bring into our house and how we eat, because I do want to make sure I'm doing what I can as far as I can environmentally wise to protect my family and myself.
Good for you. Well, and I'm glad to hear that you're genetically safe in that realm.
Yes.
Good. So you talked about you being your best advocate in the cancer binder and bringing an advocate with you. Is there any other advice that you would give to patients?
As cliche as it sounds, I think attitude plays a huge role into this journey in this battle. I always remind patients, like, it's okay to not be okay
Yeah.
and to voice that when you need to voice it. And you don't always have to just put on a tough act and a smile, but also don't. I kind of have a little saying, it's okay for the bird to fly over, the bird of fear and the bird of anxiety and depression and anger and sadness, but don't ever let it make a nest and start laying
Oh,
eggs.
wow. That's powerful, Kylie. Very powerful.
The mind is a powerful thing, and I think it plays a big role into this battle and this journey.
Well, those are good words to live by for sure. All right. Well, is there anything else that you think that we need to hear on this podcast today? Anything else that you wanted to share that you just didn't, that I didn't get to?
Don't ever stop asking questions as a patient. And yeah, don't stop asking questions. Don't stop advocating for yourself and doing what you feel is best for you. And when you have questions, call your team. ask your team, and they really do have your best interest at heart. They wanna be there for you, and a lot of your team has personal experience. They may not always share it, but they do wanna be there for you.
And don't feel like you're a burden, right? And sometimes when I've called, people say, my nurses will say, if your temperature hits this, just call us. And I'm like, well, there's nothing wrong with me. I feel fine. But we should call you, right? Because you want to just put it in our charts. Is that accurate or?
Absolutely. We wanna know about everything because if we don't know about it, we don't know how to help you. And then we also don't know that it's been going on, so we don't have a record of it. You're never, ever a burden. Don't ever think of yourself as a burden or the difficult patient ever because, yeah, if we don't know about it, we don't know how to help you.
And how much is the oncologist diving into our other medical appointments? So let's say I go to, the gynecologist or I go to my general practitioner and I start talking about that. Is that something that we need to tell our oncologist about, or is that something that they're already keeping track of?
So it kind of depends because then we get into another situation of like electronic medical records, right? And they don't always talk to each other. So it is important to say, hey, by the way, I did see my general practitioner and they switched up my blood pressure medication, or I'm starting on this new antidepressant, or um, we're going to talk about adding this into my regimen. And for us to know about that because sometimes our medical records don't always talk.
Okay. Yeah, I did have a question with that. I've heard, when you're prescribing medication, you're prescribing it based on this is the this is the testing that they do, and they do that testing in a bubble, right? So let's say I'm on, 7 different medications, and each medication has been tested, but not necessarily each medication has been tested against the medication that I'm on. So, would you agree with that? Would you agree that generally speaking, when a doctor is prescribing something, it's based on that medicine alone, the side effects alone, and not the side effects when compared to or commingled with another medication?
In the general world, yes. However, like when we are prescribing a oral chemotherapy medication, as soon as our provider puts that in, it sends an alert to our pharmacist, and then our pharmacist runs like a full drug to drug interaction of our patient's medication list.
Really?
Yes.
And is that standard practice?
It is
Do you
in
know?
the oncology. I would hope it is. In the oncology world, it is standard practice at our clinic.
Okay. Hmm. Well, that's good to know.
And so then we can ensure that if there is any drug to drug interactions in the patient's chart, we're educating the patient on that. Um, or we're changing up their medications to best ensure that there's not going to be any adverse reactions.
And so then one might expect a phone call from the pharmacist as a follow-up saying, "Hey, I just got a trigger and, these supplements that you're taking might be causing hormones, so you might want to stop that." Or should I
Cor-
follow up?
Y Yeah, so as the nursing staff, we usually follow up on that at our clinic, and that's why it's really important to be very open with your provider and their team on any supplements you're taking. So if you are taking anything like high dose vitamin C or ivermectin or fenbendazole or anything like that, to be open with your team about it so that we can make sure there are no interactions and so that we can be aware of it.
It's so if somebody decides to go that natural route, is that something that they could still come and see an oncologist about, or do they need to find an au naturel doctor, whatever that might be called?
Yeah, so they can see a holistic provider and get those medications that route. We still encourage patients to still come see us so that we can still see them and continue surveillance and still be a part of their team.
Oh, okay. Okay. I was just looking on a website, a do it yourself website, Ivermectin. I was looking at all these different things because I want to, have a little podcast about it. But anyways, one, one of the things is just go to the animal store or the pet store and get some ivermectin. Is that what you're supposed to do, Kylie? Or do they actually have human grade ivermectin? Do you know?
Please don't go to the animal store first and foremost because that is most normally like graded for horses and on that tube. I don't know if anybody has horses, but I know Tammy, you have your donkeys and like and I have horses. Like when we go to worm them, that's like a dose anywhere from 500 to 1,500 pound dose, right? So I do think that there is possibly a human dose because I have had some patients that are like, "Oh, well, I'm taking this many tablets." So,
Okay. And it's not something that your provider would prescribe because they're not a holistic doctor, but they do.
correct.
Okay. But you should still share that information and still get checked and don't go to the
Yes,
pet store to get your meds,
do
please.
not go to the pet store to get your medications.
I mean, I was just thinking about that and I was looking at that and I was just like, oh my God, people are going to the pet store. There's got to be, and actually, I know that there is. I have a friend who I'm hoping one day is going to be on this podcast, but that I know that there is ways to get it, but I just needed you to put that out there because that is some funny ass shit. Don't take prescribed dosage for a 1,000 pound animal. Start
Yeah,
injecting
please
it
don't
into
take
you.
horse. Yeah. Or for like, I know like there's like when I was showing pigs, we had ivermectin for pigs. That's like a horse one. I mean, like an injectable one. So you don't want that either.
Oh, okay. So yeah, so they even have separate ones for pigs,
Yeah.
right?
Yes.
Okay. Well, see, so you don't know. I mean, you don't compare yourself to a pig or a horse. Just go to a doctor, find somebody, or go to a website and search really high and low, but don't go to the pet store. All right.
Or get some chemotherapy.
Yeah, exactly. Or just go get some chemotherapy. Whatever works for you. I'm not telling anyone to take a certain route, but just do the human route. That's all. That's all we can say about that. Well, Kylie, I really appreciate you being on here. I really appreciate everything that you do for your patients and for your family and for all cancer people out there and for your doctors and your providers that you work with and your team that you work with. 'Cause you sound like you're a very extremely positive person. And I hope that you keep that up. Make sure that you know that every day you're dealing with those indirect traumas. So keeping up that positive attitude and taking care of yourself. So, well, that's the end of this
Thank you.
episode. And guests that are listening, please follow, please comment. If you want to be on the show, please let me know. We need more people. We need different kinds of cancer because breast cancer is one of them. And I happen to know a lot of people with breast cancer, but we need to hear from everyone. And so thanks so much, Kylie, and you take care of yourself.
You too. Thanks, Tammy.
Thanks. Bye.